Welcome to the Spelling Bee Ninja podcast, your source for free educational content that transforms learning into an engaging adventure. Join our community of curious minds as we dive into fascinating topics every week, exploring the wonders of science, history, and much more. Don't forget to subscribe and become part of our mission to make education accessible and fun for everyone. Today, we're going to take a deep dive into the life and contributions of Joseph Lister, a pivotal figure in the world of medicine. Born in 1827 in Upton, Essex, Lister was the fourth of 7 children in a Quaker family. His father, Joseph Jackson Lister, was a pioneer in the development of the microscope, which profoundly influenced young Joseph's fascination with science and medicine. His father's background as a successful wine merchant and a fellow of the Royal Society set a high standard for curiosity and scientific rigor that Joseph inherited. Graduating in 1852 from University College London, Lister quickly became captivated by the surgical field. But his early experiences in surgery revealed something disturbing. He encountered a grim reality: many patients were not dying from the surgery itself, but rather from infections caused by bacteria. This alarming mortality rate sparked a determination in Lister to revolutionize surgical practices. In the mid-19th century, surgery held a notorious reputation. Many hospitals were grimly referred to as gateways to death, primarily due to the high rates of post-surgical infections like gangrene, sepsis, and erysipelas. It's fascinating to note that prior to Lister's efforts, the surgical mortality rates reached a staggering 50% in certain hospitals. Surgeons operated without clean hands, untouched instruments, and without understanding the critical role bacteria played in causing infections. Many wounds would remain open, allowing for drainage, which paradoxically increased infection rates. The prevailing belief disregarded the existence of invisible organisms responsible for these deadly infections. Driven by this haunting reality, Lister knew that if he could find a way to eliminate infections, he could save lives and improve the surgical profession. His idea was heavily influenced by Louis Pasteur's groundbreaking work, which demonstrated that microorganisms caused fermentation and decay. Lister connected the dots and reasoned that if microorganisms could lead to rotting, they could certainly be responsible for wound infections as well. Reading Pasteur's research convinced him that the key to safeguarding patients lay in eradicating these microorganisms before they entered wounds. He even hypothesized that wound infections originated from germs in the air, suggesting that a barrier needed to be established between wounds and the atmosphere to effectively sterilize the surgical environment. This innovative thinking was a monumental shift in medical practices. In 1865, Lister began his first clinical trial using carbolic acid, also known as phenol, as an antiseptic. He sprayed the solution on wounds, surgical instruments, and even in the operating theater. This heralded the dawn of antiseptic surgery. Remarkably, carbolic acid was initially used for sewage treatment before Lister repurposed it for surgical applications. He created a hand spray that dispersed carbolic acid in a fine mist throughout the operating room, putting his theories into action. The results were remarkable. The mortality rate from surgical infections plummeted from 50% to under 15%. Lister's pioneering methods saved thousands of lives and laid the foundational principles for modern infection control. In August 1865, Lister conducted his first antiseptic surgery on an 11-year-old patient named James Greenlees, who had suffered a compound fracture after being run over by a cart. Lister meticulously cleaned the wound with carbolic acid, applied dressings soaked in the antiseptic, and covered the wound. Miraculously, the patient healed without infection, marking a landmark victory in medical history. This success supported Lister's belief in antiseptic surgery's future, leading him to publish his findings in 1867. While his work was initially met with skepticism, the overwhelming evidence of its effectiveness won over the medical community. Despite these successes, Joseph Lister faced significant resistance. Many established surgeons were hesitant to adopt his methods, apprehensive about the toxicity of carbolic acid and skeptical about changing entrenched surgical practices. Some even ridiculed Lister's idea of spraying the air in operating rooms. Yet, as Lister persisted in promoting his techniques, the undeniable evidence soon became clear, and death rates among surgical patients decreased remarkably. Acceptance of his methods took around 15 years, but over time, they became standard practice. Eventually, Lister's innovations evolved further from antiseptic surgery, which focused on killing bacteria after they entered wounds, to aseptic surgery, which aimed to prevent bacteria from entering wounds in the first place. This transition incorporated more rigorous sterilization practices, including the use of gloves, clean dressings, and maintaining a sterile environment during operations. These advancements paved the way for more complex surgical procedures, such as organ transplants. Lister's groundwork laid the foundation for these leaps in surgical safety. As Lister's techniques grew in acceptance, his reputation soared. He would find himself appointed to prestigious roles, including Professor of Surgery at King's College London and even President of the Royal Society. Remarkably, he was the first medical professional to be raised to the peerage in the House of Lords. His influence extended beyond borders, earning him accolades and honors globally. Not only renowned for his surgical contributions but also a skilled politician, Lister advocated for public health reforms and improvements in surgical practices. Retirement came in 1893 after the passing of his wife, but his legacy continued to shine until his death in 1912 at the age of 84, deeply honored in the medical community for his monumental impact on surgery. Joseph Lister's contributions extended far beyond his lifetime. His work shaped modern medicine, transforming surgery from a last resort to a safe, reliable treatment. His principles of infection control are integral to current medical practices in hospitals, clinics, and laboratories around the world. Fascinatingly, his influence catalyzed the development of the field of surgical infection control, which has saved potentially hundreds of millions of lives. Furthermore, his research laid the groundwork for the development of antibiotics as scientists sought to combat bacteria in various medical conditions. Lister's name and legacy endure greatly in today's world. His contributions are commemorated in institutions and even products like Listerine, which was originally created as a surgical antiseptic. No discussion of surgery's evolution and modern practice would be complete without acknowledging Joseph Lister. His profound impact fundamentally changed surgical practice, making it far safer and successful. His work exemplifies how scientific inquiry, persistence, and a commitment to patient safety can lead to significant improvements in human health. Lister not only changed a field but inspired future generations to pursue medical excellence and prioritize patient care. In summary, Joseph Lister's transformative contributions to surgery and infection control have left an indelible mark on modern medicine. His innovative use of antiseptics, inspired by scientific inquiry, shifted surgical practices towards a focus on cleanliness and safety. Despite initial resistance, Lister's persistence changed the face of medicine, building a legacy celebrated in hospitals today. Remember, his story serves as a reminder of the importance of curiosity, evidence-based practices, and a commitment to improving patient outcomes. Thank you for joining us on this enlightening journey into the life and legacy of Joseph Lister. We hope this episode has inspired you to explore the wonders of science and humanity's continuous journey toward improvement. Don't forget to subscribe so you never miss an episode. Until next time, keep questioning, keep learning, and stay curious.